way it's currently defined is a COVID infection or a presumed COVID infection. You don't have to have a positive test with symptoms that can come and go, are there and persist, and are getting worse, or an exacerbation of old things, an old brain injury that is worse now post-COVID, rheumatoid arthritis that's there and now worse, depression symptoms, all of that, musculoskeletal things are now worse post a COVID infection. And those things have lasted off and on or have persisted for over 3 months. And so these are pretty significant symptoms. Most patients describe a mix of things. So typically there's a layer of fatigue, there's a layer of brain cognitive slowing or trouble processing information or trouble talking, combined with interrupted sleep patterns. And then there are other folks that have rashes or kind of histamine or allergic kind of rash response. And then there's other folks that have GI symptoms as well. So all those kind of get clumped into the long COVID bucket because they got COVID or a viral infection that felt like COVID. And those things have lasted for a while and aren't getting better. Every patient is themselves. And so this is kind of a collection of what people tend to tell me. But most of the time, people talk about an underlying level of they don't have the same number of energy like they used to. And then on top of that, it seems like when they put in a certain amount of effort into something, and that could be physical effort, that could be attention, that could be a noisy environment, that could be reading a book or doing something that's a little bit more demanding cognitively. Once they cross a certain threshold, it seems like their energy tank has the plug pulled out the bottom and it goes to zero. And once they've tripped that wire, there's not a way to kind of put it back in. And it can take days, weeks, for some people months before it feels like that energy tank is filling back up again. There's some medicines that we're looking into that are helping. There's a whole Recover trial network across the whole country, and we have it here on campus where we're looking at different medicines and activity ramp-up plans and some other strategies to try and help people unlock that. The most boiled down version of this is figuring out how to get better sleep and or help figure out what are the things that recharge your battery, refill that tank. And it can be a few of my patients have found listening to audiobooks in areas that they have zero interest in is a recharge activity because it's a human voice. It's not total white noise, but because they're not interested in it, they're not over paying attention to it. And so doing that for like 20 minutes periodically throughout the day has enabled them to keep that energy level up. The other thing is finding what is the base level of activity you can do without tripping a crash. And then once you find that, increasing it by 10% every 10 days. So in its most simplistic form, if you're only able to walk 10 minutes out of bed a day, that's your base. And then 10% isn't 15 or 20 or 30, it's 11. So you're just barely clicking up that dial every so often to kind of help build that strength. And as you build strength, your stamina will follow because the stronger you are, the more you can do with less energy. You don't have to see a specialist in long COVID if you think you have it. You can work with your primary care doctor on it. You can use some of the guidelines that are out there. And really the real, when you distill it down into its most concentrated form, is try and figure out what helps and what's getting in the way. And it sometimes is a hard conversation with work, family, loved ones. What are the things that are actually the most helpful and are helping you on that path and are helping recharge that battery? and what are the things that are getting in the way or leading to crashes more often,